Human immunodeficiency virus, or HIV. Did you know that according to Bridget Barr in the HIV and the role of the HCA, that by 2013, 35 million people in the world were living with HIV? Did you also know that during that same year, according to Barr, that 1.5 million people died from HIV? This is why it's so essential to reduce the stigma and prejudice surrounding HIV in the healthcare field. In 2017, according to the Center for Disease Control and Prevention, ages 13 to 30 made up 21% of the 38,000 new diagnoses of HIV. And in 2016, ages 13 to 30, 162 of them died. Also, according to the Center for Disease Control and Prevention, in 2017, African Americans made up 13% of the United States population, but accounted for 43% of the 38,000 new HIV diagnoses in the United States. That was roughly 16,500 African Americans with a new diagnosis of HIV in the United States in 2017. However, if you think that number is terrible, listen to this. According to the Center for Disease Control and Prevention, 468,000 African Americans had HIV in 2015. And in 2016, 6,000 of those patients with HIV lost their life. Another group affected by HIV, according to the Center for Disease Control and Prevention, are Hispanics. In 2016, Hispanics accounted for 26% of the new diagnoses of HIV in the United States. At the end of 2015, an estimate of 254,000 Hispanics had HIV, and 2,000 deaths occurred among Hispanics diagnosed with HIV that year. There are many stigmas and prejudices associated with HIV in the healthcare field. Lori Chambers writes in Stigma, HIV, and Health, 3 managements that these stigmas and prejudices fall into in the healthcare field. These managements consist of risk management, fear management, and moral management. Chambers explains risk management as segregating the HIV patient, such as labeling his or her medication. She then goes on to discuss fear management, as the healthcare professional refusing to come in contact with the HIV patient. According to CDC.gov, over half the people from ages 13 to 30 believe that HIV can be transmitted through spit or kissing, which is false. This is a perfect example of fear management. Lastly, she explains moral management as the healthcare providers denying the patient care just because the patient has HIV. This is why it's so important to discuss the health equity in the healthcare field that revolves around HIV, because this can help save a life. How can discussing these health equities save a patient with HIV life? Did you also know that according to avert.org, that 1 out of 8 of the patients in the world with HIV feel as if they are receiving improper care, and that HIV patients are 4 times more likely to say that they receive inadequate attention? By feeling as if they are receiving poor care or improper care, patients with HIV are more likely not to receive care or treatments. According to HIVinsight.com, and according to HIVinsight.com, within 10 years of a patient with HIV not receiving treatment, it will progress to AIDS. Although there is no magic fix for HIV, to help spread awareness about HIV, I think it would be best to encourage others that are sexually active to get tested. According to CDC, 1 in 6 Hispanics do not know that they have HIV, and 1 in 7 African Americans are unaware that they have HIV. CDC has came out with a program named Doing It My Way to inform the general public more about HIV and the importance of getting tested for HIV. For more information about Doing It My Way, please visit www.cdc.gov/DOINGITMYWAY. Also, informing the public more about pre-exposure prophylaxis will help decrease the spread of HIV. According to avert.org, pre-exposure prophylaxis, or PrEP, is a retroviral medication that is taken daily to prevent HIV-negative patients from having the HIV infection. PrEP reduces the risk of becoming infected with HIV from unprotected sex by over 90%, and from drug use by more than 70%. From doing this assignment, I have a better grasp of what PrEP is. I always saw the commercials but never fully understood what it was. I also realized that HIV affects many lives, not only in the United States, but worldwide. Although it affects so many people, HIV still feels like a topic of taboo when it should not. I also discovered that there are many programs for people with HIV and that they should not feel alone and that they should not feel alone. Because of my awareness of the health equity that HIV patients go through when receiving care from healthcare providers, I vow to always respect my patients as a whole and not to judge them. I vow to be sensitive to their disease, and I will remember the 3 managements discussed earlier and avoid using any of them because my patients with HIV deserve respect and the best quality of care. I vow to understand that they are dealing with a lot and need all the support that they can get.